You are about to embark on another stimulating adventure in the field of neuromonitoring. This is the IONM4LIFE Podcast with your host, Scott Moore.
In 20 years of intraoperative neuromonitoring, I've learned a lot of valuable skills and signed off on a wide variety of techniques. There is one in particular I always enjoyed, however: TCDs. TCD stands for transcranial Doppler. Think of it as an ultrasound for the brain. We can use a probe to measure velocity and volume of blood flow as well as direction in major arteries that supply the brain, particularly the circle of Willis. There was nothing quite like placing that probe against the temporal window and finding that MCA and hearing it swoosh. And then making slight adjustments to depth and angle to find its related vessels such as ACA and PCA, which always sounded like a giant sheet of aluminum being shaken to me. It has that echoing quality to it. Learning TCD was fun and challenging, and there's definitely a skill and some art to properly finding the vessels in a timely manner. What's more important, though, is that the data can be vital as part of patient diagnosis for such conditions as vasospasm. You know, I talk to a lot of neurodiagnostic professionals as a podcast host, as a team leader, and as a traveling neuromonitoring specialist, and most recently as a recruiter with Neuropathway. And of course, I get a lot of questions. How can I differentiate myself from the pack when I'm applying for roles or looking to advance my career? Well, let me introduce you to Angela and Jayshree from Neurota. They operate one of the few elite TCD training programs in the nation. TCDs are a skill that's not easy to master, but very valuable to any practice. Professionals who have this skill set are certified in it bring additional value to their professional portfolio. This is a great way to add value to your program, to break your program into vascular services, to provide additional care and monitoring to our patient population. I've always highly recommended neurodiagnostic professionals learn how to effectively operate TCD. But you can't just learn this casually. You really need proper education, such as with Neurota's program. And fortunately, Angela and Jayshree are here today to tell us about their program. Here's Angela.
My name is Angela Tiaknas. I am a TCD educator and a neurovascular sonographer. And I started my career probably about almost 20 years ago. And I really enjoyed it. And I moved on and went on to do different programs and help start programs at other hospitals. And it's an exciting part of my career. And so now my business partner and I, we train other medical professionals to do transcranial Doppler.
I'm Jayshree Mahida. I have a degree in ultrasound, a bachelor's from Thomas Jefferson University, as well as I have a master's in healthcare administration. I'm registered for vascular technologist as well as cardiac sonography. I've been working as a vascular specialist at Penn Medicine for over 13 years. Okay,
so kick things off for us. How did the Neurota TCD training company get started?
So the company kind of came about because, Jayshree and I would be out and about, training different programs that were implementing TCD, and they had been trained by other people, or they kind of did the wing it kind of thing, or just really bad practice was going on. And we found that a lot of sonographers were vascular sonographers specifically, were obtaining the incorrect information, and it wasn't their fault. It was what they were trained to do. And but we were just taken back by that, and we saw it visually in front of us on many occasions. So we were talking about it one day, and we just figured, I think something should be done about it. And that's what brought us into, trying to get Neurota out there and educate people how to do transcranial Doppler correctly.
Jayshree, what's your perspective?
Pretty much would second what Angela is saying, just mentioned about. And I would also say that transcranial Dopplers do not have as much of an exposure compared to the other modalities. So it needs a lot of awareness. It's not being practiced and it's not being implemented for, in where the neurologists or neurosurgeons or hospitals across the country are not moving forward with an open mindset as to have this as a modality included in their practice.
Well, yeah. So, and let's unpack that for a second. So, it's great for us to be able to measure the electrical activity of the brain and understand what's going on from a, synaptic standpoint, if you want to put it that way. But, again, the brain it's an organ that takes up 20% of the body's oxygen supply, right? So you have to imagine how important blood flow is to the brain, right? So understanding brain activity as we do with EEG, evoked potentials, things of that nature, well and good. Imaging, obviously very important in healthcare right now, but also think about it, if we can in real time measure actual blood flow, impact of with this TCD technology, what a valuable insight that can be for treatment and management, right?
Correct. Agree.
All right, so I don't want to get too far ahead of ourselves and lose some of our newer members to the neurodiagnostic community. So tell us, in your own words, what is a TCD?
I think that, a TCD is an evaluation of the velocities within the blood vessel. It uses a 2 megahertz probe, and we go to very specific parts of the skull. And the ultrasound beam goes through the sutures of the brain, and we analyze based on different characteristics that we were trained, and we also train our students how to obtain each vessel. So it's a very good monitoring tool for certain stroke patients like subarachnoid hemorrhage. You can do the testing every day because it's non-invasive. You don't have to go to a suite to have a CAT scan. Everything's done at the bedside. And they're also done in offices, too, doctors' offices. But the majority of the time, transcranial Doppler, the best utilization of them are in an acute state or a monitoring state for stroke patients. So, but, like I said, people use them for just ischemic strokes, to evaluate any stenosis. And they're very effective if used, and trained properly.
Jayshree, what would you add to that?
I would say that transcranial Dopplers are, as you had mentioned, that they are very tech dependent. So it's a very technical kind of a job, and they're easily trainable. Like if somebody who's interested and wants to take it as a multimodality to add to their aspect of a career, I would say that it adds in value because not only transcranial Dopplers are they're portable. They can be done at a bedside. It's a smaller machine. They're cheaper. They're cost effective to the physician, to the patient, to the insurance company. They are, they do not create that anxiety level that I would want to go for a CT or MRI. They are, they see the person, they see like a transcranial Doppler is something that you get the numbers, you get the blood flow, you get the sound, you get the direction. So when, as a technologist, if trained properly, and the neurosurgeon or the neurologist knows that these are the vessels, and they are very confident when they get the results of those transcranial Dopplers. So bottom line is, I would say that it's monitoring it in real time. So it's in real time. My blood flow of the circle of Willis is happening in real time. I have to have certain criteria to even say that I am following the certain vessel. Is it a PCA, MCA? Why are they sounding different? So teaching them at that technical level, teaching them the right way, can take them much ahead of in helping the patient, for patient care, patient safety, the value of medicine at this time, the value of treatment for the prognosis of this patient. And I would also say that TCDs are the kind that once you learn them, if you know the right way, and the day you hear that spasm or you feel that because of you or what you found or what you helped, it's a very rewarding, it's very rewarding at that time. I would also say that it's used for sickle cell. It's used for babies with sickle cell. It's used for, adults with sickle cell. It's used for emboli detection. It has multiple uses, not only stroke. A lot of the Northeast hospitals here, major university hospitals, have stroke protocol where a TCD has to be performed, and a non-imaging TCD, and at that level, because they're getting that information before, they can match it up to their CT and their MRIs as to what they're getting.
Absolutely. Go ahead, Angela.
And one of the things, just to piggyback what she was saying with the, bedside and how important the information is, if you have multiple people doing this testing at a hospital or facility, and then one day, the numbers are this way, and then the next day, the numbers are a different way. We try to treat, and we use a monitoring tool to make it easier for the technologist to go into the room, look at the numbers from the previous day, say, hey, this person was kind of getting on the borderline of being in trouble or getting towards spasm. It's a very unique way of monitoring a patient that's in, a stroke unit. And it's efficient and it's effective, and it works. And I think that what has happened over time is that people are not being trained properly, and they're throwing this program into different modalities where it doesn't belong. And unfortunately, the patient is going to suffer with that, because if people don't know what they're doing, how can the doctors go by that information to treat the patient? I mean, we talk to doctors all the time about this, and they're like, I don't get it. Like, the one day the girl will get this, and then the next day the next girl gets this. And it's because they weren't trained right, or they might be looking at the wrong vessel. It's, it is, the perception needs to be changed. It's really a big part of it. And I think that's with, better credentials, better training technique, just education in general, like spreading the word. That's why every day I try something on social media about, how TCDs are effective, because I want people to know the real information, not what they've heard from a doctor, not what they've heard from one of their, technical friends, or a colleague, or, whoever. Yeah, some people are like, oh man, you don't want to do this. And then that attitude goes on to the next person, and it's just, we're trying to change that. It's really, what we're doing. And that's why we were so excited to hear, about coming on here, because this is a great forum to educate people that seem a little more interested in TCD than, other modalities. At least that's what I've encountered, is neurodiagnostic professionals are more receptive to learning this testing. And that's really exciting, because we've gotten the opposite for so long.
So in my opinion, TCDs are a valuable skill for a neurodiagnostic technologist to have, particularly in high-level trauma hospitals. So what needs to be done to make this field more visible and accessible?
It's, it is, the perception needs to be changed. It's really a big part of it. And I think that's with, better credentials, better training technique, just education in general, like spreading the word. That's why every day I try something on social media about, how TCDs are effective, because I want people to know the real information.
I would also say that transcranial Dopplers do not have as much of an exposure compared to the other modalities. So it needs a lot of awareness it's not being practiced and it's not being implemented for, in where the neurologists or neurosurgeons or hospitals across the country are not moving forward with an open mindset as to have this as a modality included in their practice.
Okay, so coming from a pair of experts here, what are some tips and tricks to get quality TCD data?
I would say with TCDs, that positioning, your head positioning, patient has to be supine. A lot of people take the shortcut of, you are in the chair, I can just do your test really quick. That doesn't happen that way. It has to be done in a proper manner. So as you said about the windows, like the technique of TCD is like at what depth I should be, which vessel am I looking at, what should be the prior knowledge that we at Neurota give when we are training a person is also like, if you're going to monitor this vessel, how that vessel should be looking like. If you said MCA is the biggest vessel and it is really quick to get, is PCA really difficult to get? Yes, it's technical. So once you get the technical, like a little posterior turn to where I am in my temporal area, I would be able to get that MCA. Does that MCA sound like an MCA? Does it have that machine-like small kind of a blunted waveform? Correct? Is my MCA above the baseline or below the baseline? Am I getting a butterfly sign? Am I in between P1, P2? So those are the very technical points I would say that help a technologist while in training and later on in their field of being able to obtain a good transcranial imaging. Another is like if somebody has a bone flap out, if somebody has sutures, if you have those sticky leads, the EEG leads, and they're right on the spot where your window is, do you go search for the technologist in the EEG department and say, can you move? Because this is very important for me to get these numbers because I can hear that spasm. I can hear that sound very far. And I'm not, if somebody has a bigger head, those are the technical difficulties. Like, what am I going to do at that time if somebody has a bigger head? Do I go more? Do I increase my depth to that level to go find is my exam going to be suboptimal? So it's not a very quick search. When it comes to transcranial Dopplers, the way I would take a probe at somebody's neck as a regular imaging, and I can say this is a CCA or this is a common femoral artery, because on the imaging monitor, I can see the images that quick. This is that following a blood vessel in real time. So not only my location, my depth, my sound, my above or below the baseline, the shape, everything comes to technicality when performing a transcranial Doppler. And I would also say that your ICA at this point is also very important. If somebody who has spasm, because that can throw off a person's ratio into mild, moderate, severe.
That's actually what I was going to say is my favorite part of teaching the whole transcranial Doppler, criteria is when I show the students the difference between the ECA and the ICA. And our transcranial Doppler machine can see the difference between the two. And a very important part of doing this exam is always having your sound on, so you can hear what they sound like, what each vessel sounds like, and see the shape, like Jayshree was saying, the shape and the way the waveform looks. So with an ECA and an ICA, if you are obtaining an ECA waveform for your ratio, which is very, very important to treatment, and you give them a number that's either really high or you give them a number that's too low, it affects that ratio. And it either could falsely make it higher or falsely make it too low, so it appears like the person's either in spasm or out of spasm falsely. So it's a very important number to obtain. And it's interesting when the students learn the difference and they hear the difference when we're showing them. They're like, oh, wow, now it makes sense. And that's always like really a great feeling when a student says, oh, yeah, this really makes sense now. And I know that I got through to them, and they take away some piece of knowledge that they'll remember when they're actually doing the test by themselves. So that's definitely a big thing that I find joy in every time.
Yeah, that's well said, both of you. And honestly, that's something I think is worth noting is, this is a skill as much for the eye as it is for the ear, It is hand-eye-ear coordination at its finest right there. So,
Correct.
Yeah, I love it. Well, this has been very useful information. So to wrap up here, let's just take maybe a minute, between the two of you. Just tell me, first of all, how can people get in touch with you, and what can your Neurota do for people who want to get involved with this field?
Well, we do have a boot camp that we're part of with Neurowave Diagnostics, and she teaches EEG, and then we would teach the transcranial portion. And hopefully listeners kind of have an understanding of what transcranial Doppler is now. And we actually we're going to get a video together to kind of, visualize what a TCD is. So some students can, because a lot of people don't know what TCD is in neurodiagnostics, apparently. So we're kind of excited about that education aspect. So, taking courses and getting registered. We have courses, we have private courses, we go to hospitals, we go to clinics. So we travel to do the trainings. And we can supply information on that, I guess, on here somewhere. And you can visit our website, www.neurota.com. And some people call it Neurota, some people call it Neurota. But yeah, either way, just give us a call if you want proper technique on transcranial Doppler. You'll know for life.
Okay, so if you want to learn more about what Neurota can do for your neurodiagnostic career or your program, check them out at neurota.com. That's neurota.com. Angela and Jayshree offer amazing courses such as how to detect emboli with TCD. They offer Zoom-based didactic training webinars, on-site clinics so you can really learn the skills hands-on. I may go sign up myself. I don't want to get rusty. Okay, that's all for this episode. Neurodiagnostic community, love and respect for you all. You do amazing work for our patients, and you are a force for good in the world of healthcare right now. Keep it up. Bye for now.